The Beck Anxiety Inventory, or known as the BAI, an overview of the development, purpose, procedure, validity, and use of this quantitative psychological assessment. BAI development. The Beck Anxiety Inventory was developed by Dr. Aaron T. Beck in 1988 along with his colleagues. Dr. Beck also developed the Beck Depression Inventory, known as the BDI, in 1961. Before development of the BAI, the BDI was used to measure expressions of anxiety and depression. While both the BAI and BDI share similarities as they are short, self-reporting inventories, each consisting of 21 questions, they are different in the symptoms measured, as the BAI is specific to anxiety symptoms and the BDI is specific to depression symptoms. Dr. Beck utilized the scales of the anxiety checklist, the situational anxiety checklist, as well as the physician's desk reference checklist to merge a list of 86 items to be considered for the BAI. After further analysis of these 86 items, 21 items were narrowed down into what is known as the Beck Anxiety Inventory, or the BAI. Dr. Beck also used the Hamilton Depression Rating and the Hamilton Anxiety Rating in his development of the BAI to find if any correlation resulted. BAI purpose. Dr. Beck developed the BAI with the intention of measuring symptoms that were specifically different from those measured in the BDI. He recognized there was a need for a tool that can measure an individual's physical symptoms of anxiety, as those should be differentiated from those of depression, being that they are two separate disorders. Before development of the BAI, the tools used in assessment measured general symptoms that could be indicative of both anxiety or depression. Oftentimes, before the BAI, their measurements would have symptoms of anxiety and depression that were overlapping. BAI procedure. The Beck Anxiety Inventory is a brief, self-reporting questionnaire that consists of 21 questions. They are intended to measure the degree of anxious symptoms that an individual is experiencing. The BAI is intended for use in those aged 17 and older. Each question is specifically related to disorders of anxiety and includes physical symptoms such as dizziness, shakiness, fast heart rate, sweating, and others. There are some emotion-based questions asked, such as feeling terrified or unable to relax, but the BAI, as opposed to the BDI, focuses on a physical measurement of symptoms rather than the cognitive symptoms measured for depression. The BAI questionnaire provides each question with a rating scale of 0 to 3 for the individual to choose the severity of a specific symptom of anxiety that they are experiencing. For 0, it would equate to not at all, 1 would be equal to mild, 2 is equal to moderate, and 3 equals severe. Upon completion, the total of each question is added together for a total sum with a possible range of 0 to 63. The interpretations of the total sum are 0 to 7 would be equal with minimal anxiety, 8 to 15 would equal mild anxiety, 16 to 25 would equal moderate anxiety, and 26 to 63 would be representative of severe anxiety symptoms. Of the 21 anxiety items that are being rated on the BAI, 12 reflect physical symptoms of anxiety, 5 reflect cognitive or emotional symptoms of anxiety, and 4 reflect both physical and cognitive or emotional symptoms of anxiety. As you can see on the Beck Anxiety Inventory here in yellow, we have the physical symptoms of anxiety that are being measured. They are numbness or tingling, feeling hot, wobbliness in legs, dizzy or lightheadedness, feeling unsteady, hands trembling, shaky or unsteadiness, indigestion, feeling faint or lightheaded, face flushed, or hot and cold sweats. For the cognitive or emotional symptoms of anxiety that are being measured, we can see them in the blue. They are the unable to relax, fear of worst happening, terrified or afraid, feeling nervous, or feeling scared. For green, we have both symptoms of physical and cognitive or emotional symptoms of anxiety. They are a feeling of choking, fear of losing control, difficulty in breathing, and also a fear of dying. BAI, validity and correlation. The results from Dr. Beck's BAI testing showed that there was a high internal consistency of 0.92. This meant that the test items that were being measured were reliable for measuring the same structure within that test. The test-retest reliability within a 7-day duration showed a 0.75. This means that the test was consistent in measuring similar results over time, and a retest will show findings as original. Correlation with the Hamilton Anxiety Rating was found to be moderate, and correlations with the Hamilton Depression Rating was found to be mild. This would show that possibly the BAI had much more in common with an anxiety rating than it did with a depression rating. Further studies have been done to test the reliability and the validity of the BAI. In 1992, Dr. Thomas Friedrich and his colleagues conducted 2 studies of the BAI among patients with anxiety disorders. In the first study, test-retest reliability and internal consistency were measured with a reliability of 0.67. This was over a duration of 11 days, and a high internal consistency of 0.94. This study included 40 patients that had already been diagnosed with an anxiety disorder. This finding was similar to that of Beck's original study, which also showed high internal consistency as well as test-retest reliability. In the second study of 71 patients with anxiety disorders, convergent and discriminant validity were measured between depression and anxiety symptoms, as well as how the BAI measured against the State Trait Anxiety Inventory, the BDI, and daily diary ratings of anxiety and depression. The BAI was found to be better than the STAI for convergent and discriminant validity between depression and anxiety. Also, the BAI correlated with diary ratings of anxiety much higher than the diary ratings of depression. Findings showed that the BAI was more useful for measurement in panic disorders with a focus on physical symptoms, but also had correlation with the Beck Depression Inventory, the BDI, which represents an overlap of depression and anxiety symptoms. BAI popularity. Between 1991 and 1998, the BAI was the 3rd most utilized anxiety assessment tool in clinical research, with the State Trait Anxiety Inventory and the Fear Survey Schedule being in the top 2. Currently, the BAI remains as a popular anxiety assessment tool as it is still used in a variety of settings, along with other anxiety-specific assessments such as the Generalized Anxiety Disorder Scale and the Hamilton Anxiety Rating Scale. The simplicity of the BAI can also allow for at-home individual assessment, which can then provide personal insight regarding a need for further assessment and possible treatment. BAI positives. The BAI is easy to understand and has a short duration of completion with roughly 5 to 10 minutes. The BAI is easy to score and can be used among various treatment settings to provide a simple view into a patient's current symptoms of anxiety. The findings of test-retest reliability show that the BAI can be helpful in tracking anxiety symptoms over time and give providers information regarding the patient's treatment progress over time. The BAI is especially useful in measuring symptoms of panic disorder due to the focus of physiological symptoms. The BAI does provide a distinct measurement between symptoms of depression and anxiety, and is considered more useful than the State Trait Anxiety Inventory, as the STAI had more correlation with the BDI measures of depression. BAI negatives. Although the BAI is useful for measuring the physiological symptoms representative of panic disorder and possible other anxiety disorders, the questionnaire underrepresents symptoms of anxiety that relate to an individual's emotional symptoms. Anxiety disorder symptoms associated with general anxiety disorder, agoraphobia, or obsessive compulsive disorder may not be measured accurately, as they have a less physiological symptom factor than those with panic disorder. The BAI did show a higher correlation with the BDI, which is representative of the similar symptoms of anxiety and depression, resulting in difficulty of separating the disorders from one another. An individual's age or health factors may play a role in how they measure with the BAI. Physiological symptoms such as heart rate or dizziness can be attributed to health conditions or elderly specific conditions that provide a false positive of the data measured. The BAI is a brief questionnaire to an individual's current symptoms, and while useful, it cannot be utilized in determining a diagnosis, but rather it can be one of many assessment tools to help collect data for a clinical diagnosis.